Gonorrhea. Gonorrhea is a sexually transmitted disease, STD, caused by gram-negative Diplococcus neisseria gonorrhea. A very common infection, especially among young people ages 15 to 24 years. How is gonorrhea spread? You can get gonorrhea by having vaginal, anal, or oral sex with someone who has gonorrhea. A pregnant woman with gonorrhea can give the infection to her baby during childbirth. Transmission is by direct inoculation of infected secretions from one mucous membrane to another. It can infect both men and women. Cause infections in genitals, columnar epithelium line mucous membranes of the urethra, endocervix, rectum, throat, pharynx, conjunctiva. Secondary infection to other anatomical sites. Through systemic or transluminal spread can also occur. How can I reduce my risk of getting gonorrhea? The only way to avoid STDs is to not have vaginal, anal, or oral sex. If you are sexually active, you can do the following things to lower your chances of getting gonorrhea. Being in a long-term mutually monogamous relationship with a partner who has been tested and has negative STD test results. Using latex condoms the right way every time you have sex. Are you at risk for gonorrhea? Any sexually active person can get gonorrhea through unprotected vaginal, anal, or oral sex. If you are sexually active, have an honest and open talk with your healthcare provider, and ask whether you should be tested for gonorrhea or other STDs. If you are a sexually active man who is gay, bisexual, or who has sex with men, you should be tested for gonorrhea every year. If you are a sexually active woman younger than 25 years or an older woman with risk factors such as new or multiple sex partners, or a sex partner who has a sexually transmitted infection, you should be tested for gonorrhea every year. If someone have the question, I'm pregnant, how does gonorrhea affect my baby? If you are pregnant and have gonorrhea, you can give the infection to your baby during delivery. This can cause serious health problems for your baby. If you are pregnant, it is important that you talk to your healthcare provider, so that you get the correct examination, testing, and treatment, as necessary. Treating gonorrhea as soon as possible will make health complications for your baby less likely. How do you know if you have gonorrhea? Some men with gonorrhea may have no symptoms at all. However, men who do have symptoms may have a burning sensation when urinating, a white, yellow, or green discharge from the penis, painful or swollen testicles, although this is less common. Most women with gonorrhea do not have any symptoms. Even when a woman has symptoms, they are often mild and can be mistaken for a bladder or vaginal infection. Women with gonorrhea are at risk of developing serious complications from the infection, even if they don't have any symptom. Painful or burning sensation when urinating, increased vaginal discharge, vaginal bleeding between periods. Rectal infections may either cause no symptoms or cause symptoms in both men and women that may include discharge, anal itching, soreness, bleeding, painful bowel movements. If you are just diagnosed, what do you do now? You should be examined by your doctor if you notice any of these symptoms, or if your partner has an STD or symptoms of an STD, such as an unusual sore, a smelly discharge, burning when urinating, or bleeding between periods. How will your doctor know if you have gonorrhea? Most of the time, urine can be used. Swabs may be used to collect samples from your throat and/or rectum. In some cases, a swab may be used to collect a sample from a man's urethra, urine canal, or a woman's cervix, opening to the womb. Can gonorrhea be cured? Yes. Gonorrhea can be cured with the right treatment. It is important that you take all of the medication your doctor prescribes to cure your infection. Medication for gonorrhea should not be shared with anyone. Although medication will stop the infection, it will not undo any permanent damage caused by disease. Antibiotic-resistant gonorrhea. It is becoming harder to treat some gonorrhea, as drug-resistant strains of gonorrhea are increasing. If your symptoms continue for more than a few days after receiving treatment, you should return to a healthcare provider to be checked again. If you had treated for gonorrhea, when can you have sex again? You should wait 7 days after finishing all medications before having sex. To avoid getting infected with gonorrhea again or spreading gonorrhea to your partners, you and your sex partner should avoid having sex until you have each completed treatment. If you've had gonorrhea and took medicine in the past, you can still get infected again if you have unprotected sex with a person who has gonorrhea. Pelvic inflammatory diseases. What happens if you don't get treated? Untreated gonorrhea can cause serious and permanent health problems in both women and men. In women, untreated gonorrhea can cause pelvic inflammatory disease. In men, gonorrhea can cause a painful condition in the tubes attached to the testicles. In rare cases, this may cause a man to be sterile, or prevent him from being able to father a child. Rarely, untreated gonorrhea can also spread to your blood or joints. This condition can be life-threatening. Untreated gonorrhea may also increase your chances of getting or giving HIV, the virus that causes AIDS. So improve your knowledge, prevent, be safe, protect your loved ones and get treated to enjoy a healthy life. Be in touch with Med & Health, and be educated on sexually transmitted infections, STD. Thank you.